Welcome to Marian Ayurveda. In this episode, we are going to discuss a disease found near the anus called perianal fistula. Why does this occur? Is Ayurvedic treatment effective for this? Or what kinds of foods should patients with this condition eat? These are the aspects related to diet that we will be discussing in this episode. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. During my student days when I was studying in college, fistula was one of the diseases I saw most often and feared the most. Experiencing that, the pain those patients go through, or in Ayurveda, the surgery generally referred to as Ksharasutra, is what I have seen most often in our college. Seeing the treatments that last for about a month when patients go through this and the pain they experience during those treatments, I have always been very afraid of this disease. So in this episode, what we are talking about is definitely not the Ayurvedic treatment at the Ksharasutra level. Instead, in this episode, we are talking about how to heal this without even that kind of Ayurvedic surgery. If anyone doesn't know the cause of this, let me just take a minute or even a second to explain it. That's all it is. A tunnel, like a passage, forms from inside the anus to the area of the buttocks, or it appears like a channel. Through this stool from the anus, or pus cells, discharge and blood all come out through this opening, or sometimes a lump forms there. This is what is referred to as its characteristic. Sometimes there may be only one passage. Other times it can branch out into 2 or 3 passages. There will be tracts like this. They are called fistula tracts. So this is a major problem. In modern medicine, surgery is often performed. In Ayurveda, a method called Ksharasutra is used. So if you ask what the cause of this is, I often feel that people who have strong acidity, ulcers, or similar stomach or intestinal issues are the ones who tend to develop these kinds of fistulas. That's what I have felt. Many times I do not treat these diseases, because in Ayurveda, it is usually doctors who perform surgery, those who have completed BAMS and then specialized in MS surgery, who generally provide such treatments. That is why I do not do it. However, coincidentally, recently I have started seeing a few patients, IBS patients, those who are said to have inflammatory bowel disease, bowel syndrome, or Crohn's disease, who are presenting with such fistulas. In those cases, we do provide treatment. So, when we provide treatment for them, I have started noticing minor improvements in this condition as well. That is how I realized that when the intestines are affected by diseases, these kinds of fistulas can develop. So even if they don't have IBS or Crohn's, when I treat many patients with fistulas, almost all of them have various intestinal issues. So as I started treating the intestines of people with such problems, I began to observe significant improvement in this condition as well. That's how I started to pay more attention to this particular area. Once, a patient came from a town suffering terribly from a severe fistula, unable to even sit because the pain was so intense. So he went to 2 or 3 hospitals, he consulted doctors, and all of them said the same thing. Surgery is the only solution for this. That's how he ended up coming to me. My very first fistula patient asked me if there was any way to avoid surgery. Is there any other option? At that time, I myself didn't have much of an idea. I said, let's try and see. Because the reason is this. The cause of this is acidity in the stomach. Similarly, we had developed a medicine that helps wounds to heal. That medicine was actually developed for other diseases. What I gave them was a special medicine we had made to reduce acidity in the stomach. I gave medicine to reduce the acidity in the stomach, and similarly, there is an oil for healing wounds. That oil was given to be applied with cotton and placed at the anal area, or to be applied directly to the anus as needed. This is how I gave it. Within just 1 week, they experienced significant relief. The pain reduced considerably. So after that, it's been about 2 or 3 years now. That patient has not come back till now. For a short period, they continued the treatment closely. So what I understand is that they have completely healed. After that, I was able to do this for many others as well. For all of them, by giving this type of medicine, the intestines would dry up, and at the same time, the oil applied externally, applied through the anus, or sometimes I would instruct them to soak cotton in this oil and place it in the anus. By doing this itself, all of them experienced healing. So the reason I made this video is because fistula is a major source of pain and problems for many people. Sometimes even after surgery, the disease can return in a different form. For such people, there is a treatment that costs only around 1 or 2,000 rupees at most. Sometimes just 1,000 or 1,500 rupees is enough. With this itself, we can escape from a disease that would otherwise require such a major surgery. Now, what kinds of foods should these people pay attention to is the next point. As I said, I feel that acidity itself is the main cause of this fistula as well. So because of that, you should significantly reduce spicy and sour foods in your diet. Reduce items like tea and coffee as well. If you use things like green chili, black pepper, or similar spices, make sure to eat your meals on time and sleep on time. We also know that constipation is an important cause. So try to eat more foods with fiber content or eat more fruits. When you work sitting for long periods, just sitting alone does not cause this for everyone. But when acidity also develops along with sitting, that's when these kinds of tracts start to develop. So what I'm trying to say in this video is that these are conditions we can treat and cure without much difficulty. All we need to do is pay attention to the patient's diet, reduce spicy and sour foods, follow a regular meal schedule, and with the help of such medicines and by consulting a good Ayurvedic doctor, we can definitely treat this condition. Let's meet again in another episode. Thank you.